Hi, I'm Tyrone Reid, senior reporter with the Gleaner. I'm undertaking an investigative venture. I'll be seeking employment with La Masa Limited as a porter to gain access to the Kingston Public Hospital and the Victoria Jubilee Hospital, where we'll be trying to ascertain the level of patient care. There have been numerous complaints where patients have complained about how doctors and nurses and other health professionals have not treated them properly. We're going in to see if we can ascertain if this is actually so. We will also be looking at the work that the porters do, because they do a lot of hard work and they're complaining about the remuneration. They went on strike recently, and we are just going in to see how much work do they really do, and try to see if there is a case for increasing their wages. In order to gain employment at La Masa Limited, I must take in 2 references, which I have here. I must also submit 2 passport-sized photos, and I also must submit a copy of my NIS, TRN, and a photo ID. And I have it all here. I'll be going to the office to fill out the relevant forms, and we'll take it from there. Hi, my name is Tyrone Reid, senior reporter with the Gleaner, doing a debriefing after my first day incognito at the Kingston Public Hospital as a supervisor with the La Masa Limited. I supervised janitors and porters. It was largely an uneventful day, but some weaknesses were noticed in the operations at KPH. For example, medical records were still left unattended. And I say still because the Gleaner recently did an investigation that showed that medical records with people's private information were being left unattended, that all and sundry could access them. I find that the system is still lax in that regard. The physical property leaves much to be desired. There is old pieces of equipment lying around in certain areas. One of the most striking things, however, is the fact that the people who are charged with keeping the hospital clean, the La Masa workers, the porters, the janitors, they are being housed in a building that is absolutely filthy. It is quite ironic that workers who are asked to ensure that a certain level of hygiene is maintained at the hospital have to operate from a location that makes your stomach turn. This is debriefing number 2. Today is my second day working undercover as a supervisor with La Masa Limited. I supervise porters and janitors. The highlight of today was an incident involving a young man who policemen accused of committing a triple murder. I heard them refer to him over and over as Chen Chen. Apparently, according to information the police officers gave, Chen Chen threw urine on a policeman at the lockup. They did not say how Chen Chen suffered the bruises that were seen all over his body and his bloody lip, but the officers kept repeating over and over, how can you throw urine on a policeman? And also suggested that no one should feel sorry for the young man because he was a murderer, someone who had notoriously snuffed out the lives of 3 people. The conduct of the policemen was rather unprofessional. One of the policemen said to his colleagues, in reference to Chen Chen, "Where is he now? Is he being admitted or is he at the morgue?" And the other policeman responded by saying he should be at the morgue. One of the other policemen who came with the party of 4 policemen also made some disparaging comments about the accused. He also had a kerchief tied around his neck, and his mannerisms were not in keeping with what should be that of a member of the security force. When they just brought Chen Chen to the entrance of the accident and emergency unit, he was practically dragged from the van and his body hit the pavement like a piece of meat on a slab. His hands were handcuffed behind him and they just threw him in onto a wheelchair, and while he was sliding out and he was being held up only by his neck, the policemen were still pushing the wheelchair. It was really a scene, something that should not have happened in the way it happened. The professionalism and the conduct of the officers left much to be desired. That, as I said earlier, was the highlight of today. This is my 3rd day as a supervisor with La Masa Limited. Today I did quite a bit of work. I collected my ID today. As I told you, La Masa is a janitorial and porterage service company, and we offer that kind of support to the Kingston Public Hospital as well as the Victoria Jubilee Hospital. I noticed today that men and women were sharing the same ward, Ward B. I think it happened on another ward as well. I also noticed something that, practice that is questionable. Patients who are old and infirm were tied to their beds. About 4 of them I counted on Upper Untold, that's the ward. 4 of them were tied to their beds with cloth, which is not in keeping with international best practices. My walkthrough today confirmed that the hospital is ripe for an expansion. At least one ward had to be housing patients on the outside in the lobby. A young man who was discharged today, he had to sleep on a stretcher outside the ward. On some wards, articles of clothing were seen on the grill, flying in the wind as it were, 90s, slips, scarves, dripping wet underwears. The Mary Seacole ward had it has 2 levels. Mary Seacole ward has 2 levels, but no elevator, and old lady was on a stretcher and she had to go up these inclines, and she could be heard moaning and groaning as the porters had to be running to make it up the incline with her. It was painful to to watch. An admin official complained to one of our supervisors today that the mattresses on the ward, on one of the wards, must be removed with dispatch. I have seen mattresses lying around on several wards, and this admin official, a senior official I am told, was complaining bitterly that something needs to be done to remove these mattresses because they are infectious as they contain bodily fluids. Debriefing number 4. Today was my 4th day on the job, working as a supervisor with La Masa Limited at the Kingston Public Hospital, the nation's high seat of medicine. Today reinforced a problem that was evident on day 1 of this undercover assignment. The hospital is in dire need of wheelchairs, and good ones. Most of the existing chairs are banged up. One of the chairs I saw had a dirty piece of cloth tied to the base of it. Apparently it is supposed to act as a footrest. One of the chairs used tonight to bring a young lady into the accident and emergency unit. The back of it was practically non-existent. The porter, after placing the patient in the wheelchair who was passed out, he had to practically hold her up himself to prevent her from falling out of it backward. There is also a lack of professionalism. Expletives are used by just about everyone, and sometimes in earshot of patients. Crude, sexually laced comments are a dime a dozen. The level of professionalism leaves a lot to be desired at the hospital. There are the good moments. A patient who was accompanied by a nurse all the way from Maypen, I think she said she was from. She had just $7 of credit remaining on her cell phone, and she was on a stretcher outside the X-ray department waiting to be examined, and she gave him a phone call to contact a friend or relative. The last $7 she had. That was one of the good moments. There are good moments where I noticed proper patient care, where the nurses or the doctors, were taking, their time to ensure that the patients were well taken care of. But the KPH is in dire need of some attention, and if the government doesn't do something quickly, I think the standard of patient care will continue to decline. And sometimes it's not because the doctors or the nurses or the other professionals don't care. It's simply because they just don't have the necessary things to take care of the patients. One porter told me that there were 15 wheelchairs and 8 stretchers to serve the entire A&E and casualty units. That is woefully inadequate, especially when one considers the number of people who pass through the KPH on a daily basis. The infrastructure at the hospital really needs some attention. I noticed a window on Ward 3 North, where half of the grill was missing and more than half of the window panes were gone. A troubled patient could easily jump to his or her death through that opening that was there. That is something that also needs to be addressed. I was really impressed by some of the porters and the level of commitment that they showed to the job. The janitors as well. One porter, and if I could quote him, he said, "It is a pleasure working with people saving lives." and watch the money. You know, it was really heartwarming to hear something like that because they really aren't paid well. But you know, he believes that his service is for the greater good.